want to thank you very much to Mr. Pravin Potala for inviting me as a speaker as this STEM Chapter 1 session. I was glad to meet you all, the participants and the speakers today. I say hello to Cluj-Napoca. It's a university city in Romania. We also work at the University of Cluj-Napoca, Medicine and Pharmacy. And I am part of the oral rehabilitation department of dental medicine faculty here in Cluj-Napoca. Now I will try to present you some eccentric issue that it is facial biometry and facial contour that is very kind repair in oral rehabilitation. I will enter direct in a case presentation. Why? Because I wanna talk with you about patient expectation in front of oral rehabilitation, the expectation of the specialist in dental field, and we must join all the expectation because the patient need aesthetics, and the specialist want to rehabilitate all the function that patient lose in his statement of edentation patient. We have one issue, one task when the patient is with all the tooth in the mouth, and the patient needs aesthetics, and he wants a remodelation of the frontal group, and he talked with us to make him a better smile, a better look. But when we have patients doesn't have the frontal group, the dental frontal group, it is a problem. The patient need everything new, everything beautiful, but he doesn't know what he wants. And the shape and the volume of the tooth, the restoration prosthetics will be aleatory, and in the field of dental technicians that do that prosthetic works for the patient. And it is the possibility to do the same shape and the same volume for all the patient, because we think that he look nice. But we can construct individually all the shape and the volume for the patient in front of his expectation, extracting the shape of the face, measuring the face, and make some keynotes from the facial repair to reconstruct the tooth, the anterior tooth. This is the first case, and I will show you the steps. What are the steps to make a reconstruction dental reconstruction of the frontal group with repairs that we make acquisition on the face? The first step is to make a line, an interpupillary distance, and measure the interpupillary distance. After that, we have the horizontal dimension of the facial contour on the occlusal plane. That is parallel with the interpupillary distance. The third line is the vertical line. That is bilateral on the face. The vertical dimension on the line is on the sagittal plane. We measure with a virtual linear. That is in our prototype soft. Evidence of facial contour and central maxillar incisor, and incisor contour overlap on the contour of the face. We can make the measurements of all the wrapper on the face. We can do the contour of the face. The important thing is the contour of the face is not the contour of the cranium. See it from the frontal plan. We have now the tooth of the patient that the patient is not satisfactory with this shape. You want veneers for reconstruct everything from with the wrapper of the face and in the harmony of the face, and it's very difficult. We can see that the shape of the tooth is quite okay on the shape of the face. That it is harmony between the tooth and the facial aspect. There we have the tooth of the patient, and in the left we have the face and the overlap. Now we must eliminate the incisal third and the afferent upper facial floor, anterior guide function of the mandibular teeth on the maxilla. Why? Because the dimension from the cervical to incisal measurement, it is functional. We have an incisal edge that is functional with the antagonist that is mandibular, and the incisal edge is functional. But we can reconstruct from the wrapper of the face, we can reconstruct the shape and the volume of the tooth for the edentarius patients. We made a section of this overlap image that we made from the interpupillar plan, and after that we see what is the contour of the tooth, what is the contour of the shape of the face, and equilibrate this overlap. We have now two contour overlap, that is the shape and the tooth. We have the face, the measurements, and the tooth contour. We see that the tooth contour exceed the face, and we have overlap from 90 to 37%. That means we have a good precision of fitting the face contour and the tooth contour. That in the front of what I present you till now, it is a possibility to reconstruct the central incisor, the permanent central incisor, with the shape of the face. We have some exception. When we have a mandibular shape, when you see here that I told you the shape of the cranium seen from the frontal plan is not the shape of the face. The shape of the face are here where the shadows of the face are. We have also the measurements for the face of the patient. We have the shape of the tooth, and we will see if the patients overlap this contour, join with a good percentage for a good construction. We have the face, and you will see the overlap of the patient tooth, the natural patient tooth, and now we have the percent, 96, 90%. That it's a good percentage for overlapping the contour of the tooth and the contour of the face. That we can conclude that we can extract all the information from the face of the patient to do a natural and beautiful and individual smile, begin to central upper permanent incisor. Now, we remodelate in wax at the model cast in dental laboratory. We reconstruct the tooth and try to make a better percent, to see what we can do for this patient to look good and harmonical with the face that they have. And also we try to do satisfactory um, to satisfy his expectation, because the patient were the final reconstruction, and we try to do it very well. We try to exceed the percent to 92 to 98%. That is 4% plus, and the patient is happy. He looks different with just a little modification of the frontal group. That's the before, that's the walks up, and the digitalization of the tooth. What we have now, it's very important, because the patients need a smile, a beautiful smile, but we, like a professional, we must preserve that smile that we do to the patients in time, because the patient doesn't need a smile just now. He needs a smile for a long time. And now it is the structure and the resistance. It is the patient who needs aesthetics and is just like the frontal group, but are the patients that are uh, with a larger indentation in the oral cavity, and we can start from the face. We extract the shape and the form and the volume of the central incisor, and after that, with the key, with the golden key, we go to the tooth that we can reconstruct in the oral cavity. Like home, we need to do in a resistant time. The reconstruction must resist. That is very important, because we need analyze and planification. Like a house, the reconstruction is very important as a resistant structure, but also as a beautiful aspect. Indeed, we begin with the oral scanner, we go to the lab, and after that we made a digitalization of the smile, begin with the central incisor, and the form and the shape of the central incisor is made by all the measurements we do to the face of the patient. That's important, because all the reconstruction, smaller and bigger reconstruction, we can do it with biometrics. We can do a rapid prototyping works, because we have the time to do things. And now it's very important to do the validation of the treatment. The patient needs a validation. The validation of the treatment is made by stories that we tell with the patient, but the patient need to see. And now I will go quickly with two cases, because I think I have time for this, to see how I do the things with a large indentation measurement the face. We have in the green spot, that means planification. I made planification of the case now, and I need a validation for patient, and I need a validation from the patient, because he need to know what we do there in the oral cavity. Now, we made some digital project, and it's time that the patient to see that. He can see the photos, but doesn't understand what will be happen in his oral cavity. We have a prototyping, a rapid prototyping work that the patient will be wear it for, I don't know, 1 hour, 2 hours, and see what will be happen there. The patient will see the volume, the patient will see the shape, will see all the tooth that we reconstruct, and all the gingiva and all the tissue that we reconstruct, because the patient lose soft tissue, bone tissue, and the tooth units. And now is the first time that the patients see what we want to do, because all the stories that we tell the patients, it's quite unusual for his imagination. And now with rapid prototyping and this temporary works, the patient understand what we will have at the final of the treatment. And now we, like a professional, know what is the volume of the reconstruction, what is the shape of the reconstruction, using the measurements and biometry of the face of the patient, and the patients see what will be look his prosthetic work at the final end, and everything is happy, and we go up to work. It's a larger work. We can't do it just from one piece because it's a complex work, and we'll have a dental part, and we have a bone structure gingival part, and everything will be okay. Now I will present you a case that doesn't have time for planification, and everything will go wrong when you don't make the planification of the case. We have 4 implants in the position of where we have bone to implant that, but we don't know where will be the prosthetic teeth. It's important to see where will be the tooth of the patient, and after that do implantation to see when I can do the structure and the resistance for this patient. I just have 4 implants for telescopic crown, very beautiful, very expensive, zirconia screw with the primary crown. We have golden crown for secondary structure. We have also the next part and digitalization, the structure for the prosthesis. Everything is going well, but at the end, I don't have space for the prosthetic tooth. And I don't know what to do a short, to buy a short set of tooth to do there, his prosthetics, to make some individualized tooth there. I don't know what to do because I don't plan nothing there. It's very important to plan and make a diagnosis there, because the end must be as a diagnosis, not the reconstruction must be just to fill the space, the prosthetic space. And that I recommend all my students and all my collaborators to make a planification, to make the facial measurements, to see the problem from the planification, and after that we do the execution of the prosthetic works and all the oral rehabilitation, because we need a response from the patient, we need a validation, and after that we need to make a reconstruction that have a long time wearing. It's very important that patient to see a temporary reconstruction made it with the measurements of the facial repair, because it's important to see, because in his mind have some ideas of what will be, but when you see, everything is clear, and the validation of the plan of the treatment is very important in oral rehabilitation complex treatment. I will see you just one case to see what we do for the patient that have old works, prepare it wrong, and how we do the structure from the SLM technique, printing technique, and do it well for a long time wearing prosthesis. We have the structure just fine for the physiognomical part, the aesthetical part, the ceramic part, with digitalization of the measurements that we can make the acquisition from the face and the measurements, and the patient are very happy because has they will have a good restoration, a fine restoration in front of his harmonical face. And this is the case that I told you. I finished the case yesterday. I tried to have some photos from the college that fixed the prosthetic works, but I don't have. Maybe in the next year I will present you the result of the case. Now we have the digitalization and we have the walks up in the construction with the facial repair and the measurements of the face. The patient need a reconstruction, a beautiful reconstruction, and the tooth are just in this shape, like this, and that's the before, and that's the after. The proportion of the tooth was the problem of the patient. He needs a slim tooth. That was his problem. And we make a smile, a prosthetic smile to go home in plastic to see and validation for the family and for the friends and for the husband. And we reproduce now in ceramic everything that the patient was happy. And that's the study that I present you in the front place. The percent are go up to 95%, that conclude the central incisor have a lot of overlapping on the contour of the face. We can make the face, the measurement face, and after that we reproduce it on the frontal group reconstruction. That are the percent. The medium are 94. That is a very good response. That's the last case, a patient with diastema and space between natural tooth. We measure the face, we make the contour, and we reproduce with smile design of this case to do a better smile. Now you wear the prop smile, and we will do veneers for this reconstruction. But when we begin to construct the veneers, we will have the validation of the treatment. That's very important. Always validate with the team, with the dental technician and with the patient, the planned treatment and be sure that the expectation of the patient and the professionals will be 95%, I think, because 100% is not possible. Thank you very much for your attention. If are some questions, please shoot it. And if it's not, you can write me by email and I will try to answer you. Thank you very much, Mr. Praven Potala, for the invitation and all the participants to listen to me today.